The federal government has inaugurated the first Infectious Disease Centre, IDC, in the Federal Capital Territory and handed it over to the University of Abuja Teaching Hospital, UATH. The Minister of Health, Dr. Sage Hanire, performed the inauguration of the 40-bed centre in UATH, Gwagwalada, Abuja. The minister also inaugurated two other facilities in the hospital, which include the Accident and Emergency Unit with a 32-bed capacity, an intensive care unit, radiology suite, dialysis unit, fully equipped dedicated operating theatre and oxygen supply, and the cardiology unit with a full complement of facilities for non-invasive procedures, including a 4D echocardiograph.
This purpose-built infectious disease treatment center will go a long way towards improving our capacity to respond to infectious diseases in the Federal Capital Territory catchment area and even beyond. It now has laboratory testing and case management capability in one location, with much shorter turnaround time between sample collection and infection confirmation, which ensures early initiation of treatment and therefore reduces mortality associated with delay in obtaining results after diagnosis. I'm proud that today we have a center built to international standard with critical medical and laboratory equipment, where we can manage highly pathogenic infectious disease cases.
In his remarks, Dr. Chikwe Ihekwezo said the project commenced in 2019 following the outbreak of Lassa fever in 2018 and the urgent need for a center to manage infectious diseases.
When we began the establishment of this center in 2019, who would have thought that 1 year down the line, we would be in the middle of a pandemic of this scale? Today, we now have a center in the FCT that can jointly manage highly pathogenic infectious diseases and also carried out the diagnosis of this center. Because in addition to this center, it's a lovely new molecular lab at the back of the center that will serve not only patients in this center, but any other patient that come into the hospital with any suspicion of a highly pathogenic infectious disease. As the COVID-19 pandemic, has shown, no investment in our health system is too much. Not since the end of the Civil War has an event brought the entire economy of our country to a standstill.
Meanwhile, at the official handover ceremony, Professor Bisala Ekele, the Chief Medical Director of UATH, reaffirmed the commitment of the hospital management to ensuring optimal utilization of the treatment center for the management of infectious diseases in the FCT, including the ongoing COVID-19 pandemic.
We are here today to witness the handover and commissioning of the Infectious Disease Centre, built and fully equipped by the Federal Ministry of Health using the Nigerian Center for Disease Control. I shall refer this center from now henceforth as the IDC. The IDC is a 30-bed state-of-the-art edifice, as you can see, and the first of its kind in Nigeria. I understand the model is being replicated in the other 36 states of the country. In fact, the addition of this Infectious Disease Centre and the two other projects that the Honourable Minister shall commission today will bring a new milestone to our hospital. It will convert the hospital from a 350-bedded one to a 520-bedded teaching hospital, the biggest hospital in the Federal Capital of Abuja. We sincerely thank the Honourable Ministers, the Permanent Secretary, the DG NCTC, and the Director of Hospital Services, and all others that have made this feat possible. Infrastructure and equipment in the hospital will need appropriate personnel to make them function so as to attain institutional goals and objectives. In this light, we at the University of Abuja Teaching Hospital are indeed very fortunate, for we have obtained the necessary waivers from the Permanent Secretary, Federal Ministry of Health, the Head of Service of the Federation, and the Director General Budget, my good friend, Mr. Ben Akabuezi, to employ additional 200 clinical staff to man this 520-bed teaching hospital.